Minister, I also want to revisit the issue in relation to cancer screening services. And I just want to put the point across from a woman's point of view. Women are worried, and many women, and I would encourage everyone to avail of this screening when it's available to you. When you turn 50, you get a letter in relation to breast check. It's the first time you get it, and you were invited to avail of a breast check service. I know a lady that availed of that breast check service 2 years ago, and unfortunately she was diagnosed with cancer, but she had a great outcome because it was found so early. Also in relation to smear tests and cervical check, it is so very important for women's health. And genuinely, women are phoning me on a regular basis, and I'm sure they are contacting lots of people, that they are genuinely concerned. Now, I acknowledge your answer there, but I think it is very important that we do get clarity. We need to reopen cancer services as quickly as cancer screening services as quickly as possible. And I understand the obvious health and safety challenges posed by the pandemic. So, in light of the answer you have given already, can I ask you, Minister, can you clarify whether people who received tests prior to the suspension of cancer screening services, which would have happened, I suppose, in March and April, have they been receiving results in the interim period? I know our laboratories have been under pressure due to the pandemic, but surely administering results of those who received tests prior to the suspension should be the first step. We all know the earlier you catch cancer, the easier it is to treat. But if people don't get their diagnosis, they can in turn be in serious trouble down the line. Gaurav Mahagut.
So, Deputy Butler, I might write to you with a little bit more detail on screening so as not to use up your colleagues' time, but I know how important this issue is. I know how many times you've raised it. I do want to just say the National Screening Service is holding daily meetings in relation to this. I am very satisfied with the work being done by Dr. Caroline Mason-Mohan. Dr. Mason-Mohan is the Interim Director of Cervical Check. She is a public health doctor as well. She is leading the working group on it. I think it's appropriate that this is led by clinicians. I do think, though, that they need to link in with the advocacy groups and inform them as well, and I'm hopeful we'll have more news on that very shortly.